today.
Thank you. Good morning. I'm going to step up on the stage here. Not that everybody can't see me or anything, but thank you, Epic Staffing, for hosting Sanibel. It's always a great meeting. Love coming down here, and just really want to thank LivaNova for sponsoring this breakfast as well. Again, my name is Keith Atwell. I'm from the University of Tennessee Medical Center. I'll start out with saying I do not have a financial or a contractual obligation to LivaNova, but I do have an obligation to quality. So been doing perfusion about 20 years, and over my 20 years, I've grown up with Kobe, which was Soren, which was LivaNova. So, and I've used a lot of their equipment as well as other things as well. So from the Stockard 8000s to the S3s to the S5s to the new Essenz, they've all been quality for me and the people that I work with their tubing packs. So it's my pleasure to introduce Matt Schuldes. He comes from Eau Claire, Wisconsin, up in the Mayo health system up there, and he's been a perfusionist about 9 years. And he gets to talk to you about the new Essenz pump today. And one of the reasons that LivaNova asked me to come up too was we just got our Essenz about 6 months ago, and the quality assurance, quality indicators, sleek design of this new pump, the signature footprint of this new pump has been a life changer. I know Matt's going to share that with you. So really appreciate you coming out this morning, and I'm going to hand it over to the sleeker, newer technology Matt here. So, thank you.
Can you hear me? Thanks, Keith, for the nice introduction. Again, my name is Matt Schuldes, and I work at the Mayo Clinic Health System in Eau Claire. I've been a perfusionist for 9 years, supervisor of perfusion there since 2021. And I wanted to highlight, just in my initial slide, the beauty of our hospital. You can see Eau Claire is such a pretty city. It sits on the confluence of both the Eau Claire and Chippewa River. And our patients have like a wonderful, serene view of Half Moon Lake where they get to recover from heart surgery. So as we get started, I have no disclosures to announce. I don't own any of the rights to the pictures, and the opinions expressed are my own and not necessarily that of my employer. I'm here just to present my own experience with our new generation pump trials, and I do own the pumps I will be talking about. So my hospital is at 304 beds, level 2 trauma center, and a strength of our hospital, we have a proximity to Mother Mayo in Rochester. So we're about 97 miles, an hour and 45-minute drive, and if you do ECMO transport, 30 minutes ground to ground. Our health system is kind of different from the enterprise. We operate as a unique entity, and we're the only health system site in Mayo to offer cardiac surgery. So you can kind of see all the different dots there are within the health system, and it's actually a collection of about 16 smaller hospitals, 53 multidisciplinary clinics, and 1 mobile health clinic. So you can see that the Mayo Clinic supports basically 3 big hospitals, and then all these small hospitals are included as one entity. And what I love about our hospital is a town of 70,000 people. You can drive 15 minutes in any direction and end up in a cornfield or woods. So if you guys like being outdoors, it's a very unique opportunity in a hospital to actually practice cardiac surgery. The 3 surgeons that we work with, Dr. Nishant Saran, Thomas Carmody, Bob Wickman. On the top right is Nishant Saran, and he is actually a transplant from Rochester, but he brought aortic surgery to the health system site, which it's really nice to be able to practice different things than just cabbages and valves every day. So our bottom 2 surgeons, Carmody and Wickman, are primarily off-pump cabbage surgeons and minimally invasive valves without robots. We have a 4 perfusionist team, myself, Mandy, Josh, and Dylan. 3 of us are actually from the Mayo Clinic in Rochester. And then we have 1 person, Dylan, who came to us after, a little bit after we moved over from Rochester. 2 of us went to Midwestern University. For all you out there, I see a couple of my classmates. It's exciting to see you again. And then 2 of us went to Iowa for school. The 3 boys were actually originally from Wisconsin, so all of us made the pilgrimage back home. So as a team, we staff 2 cardiac operating rooms. We do 250 to 350 hearts a year since I've been tracking it. The 250 was kind of the low number during COVID years, but lately we've been up around the 350 hearts a year. Again, mostly minimally invasive valves, off-pump cabbage, and then lately aortic surgery. So historically, perfusion at my hospital was done by contract perfusion. In 2021, there was a retiree, and the contract company couldn't recruit anybody to come work at the hospital. So the hospital was actually able to create a hybrid method of employment where the hospital would employ 2 perfusionists, and then the contract company would employ 2 perfusionists. Very interesting. It ended up working actually pretty well. So I moved over there in 2001 as soon as the job was open. I actually was a nurse at this same hospital prior to going to perfusion school, so I had relationships with the surgeons that were there. So it was a very unique opportunity for me. Kind of moving back home, I also did my undergraduate in Eau Claire. At the time, we had 2 bypass machines. We used S5s, and we were able to negotiate a third as soon as I moved over there, which was wonderful. We generally staff 2 cardiac operating rooms in the morning, and being able to set up a pump while the 2 cases are going on is really helpful for safety. So after I was employed there and we got settled and we got our pumps taken care of, we looked for a 4th perfusionist, and we actually got 4 applications for just the 1 position. So at that time, the hospital said it's time to move over to be fully hospital employed. So we did. However, this left us in kind of like a problem spot. We didn't have our own bypass equipment. So, do we lease bypass machines? Do we buy new bypass machines? Do we wait for the new generation pumps that we knew were coming out? Thankfully, the contract company was more than happy to sell us the equipment that we were using. 2 of the pumps were from 2013, so they were essentially end of life. And then we had 1 new pump, which was, we just had to pay for, which is fine. However, in going through this whole process of finding what kind of pump we were going to use, Mayo Clinic decided, hey, you guys have a good range of experience perfusionists there. You have a great proximity to Rochester. Why don't you go ahead and test all the new generation pumps for the rest of the enterprise sites? The rest of the enterprise was kind of in the same boat where most of their pumps were end of life. So we moved forward with trials on both the Spectrum and LivaNova pumps. For this talk, I'll just be talking about our Essenz trial. You can see some of the pictures there. We really enjoyed getting the pump in our hands and just essentially playing with it. We really, really liked the modular pump system and how you can essentially, put a pump wherever you want it. So you get to choose right away, left or right side. It's a 3-pump base, so from all of you that run a larger base, I remember using a 5-pump base in Rochester. It really felt like a boat. Now we're down to like a 3-pump base, so nice smaller footprint. For us who roll pumps in and out of the rooms, the cabinet has 2 bars right on each side, and it's very easy to push and move and steer. And we really enjoyed getting this in for trial. Initially, when you do your trial, you just kind of want to make everything fit on your pump. And we used a lot of equipment, as you can see in the pictures, and it all felt like it fit really well. So here's some of the pictures of all the different masks that they offer. And what I really appreciated about this masked system is that you can make your pump fit your current disposable setup, which I think is really important during a trial, but you can also think about how you want your pump to look like in the future. You can essentially place a pump wherever you want it, so you can really work to minimize your prime volume by getting everything kind of close to your disposables. And we really thought this was going to be very beneficial for our future setup. So there were a couple stipulations when we ordered, or when we did our trials with our pumps. First of all is that the entire enterprise sites would have to agree on the same pump. For Mayo Clinic, that means purchasing 29 pumps at a time, which gives us kind of a unique buying opportunity. It also allows us to split up some of the work. So we're kind of in a unique spot at Mayo where we like to help each other if we have staffing needs. So we also get together and work on projects together. So getting a new pump, we kind of split up the work between each site. And obviously, since I'm here and talking about Essenz, we obviously went with the Essenz pump. Some of the things that we really found beneficial was the transition from the S5. The pumps felt very similar, and from what I understand, they're also the same direct drive system. I was very excited in hearing that, because I don't know how many of you guys utilize the S5, but some of our pumps had 20,000, 25,000 hours on them, and they were still going really strong even at end of life. We really liked the flexibility of the mass system. The pump felt like it could change as your perfusion setup changes. We really liked the history of reliability of the LivaNova pump and system. To me, reliability is kind of safety, and LivaNova's been around for a really, really long time. And from using S5s, I've never really had a problem with any of the pumps that I've used. We really like the electronic charting system. We use Epic for most of our charting, but the Essenz patient monitor has the ability to work with Epic, and we're currently working on having the patient monitor work directly with our Epic system. And lastly, we really appreciated the field team and responsive support system of LivaNova. Whenever you have a problem, I feel like you can just call up your rep and they're right there. Lastly, I think the cockpit and everything felt very, very intuitive. I appreciate not too many busy colors in one screen, and I feel like colors really draw your attention. So I really like the way that the pump felt and the cockpit felt in setting it up. So in 2023, we added 3 pumps to our budget, and with the expectation, of course, since we just got new pumps, that there's no way we would get these right away. Little did we know that we would be included with Rochester in our pump purchase. So you're very happy at one point. You're like, oh yes, you know, we're getting new pumps, and at the same time, it's like, what have I done? There's so much work now to do. We just finished getting our S5s like all situated the way we wanted them. So luckily enough, you know, I have a team. So the first thing I look to do is kind of split up the work, and what better way to tackle a project is than to get your team involved, and what better way to get buy-in from your team than to get your team involved in the project. So one of my coworkers really likes to design and mass mount, have an overall design of the pump. So he was going to focus on, you know, where we want our screens. We didn't have the luxury of just buying all new stuff. So when we got our first Essenz machine, he actually cut out cardboard that was the same size of all of our screens and devices, and started putting them everywhere on the mass system that we got to try to make it a good design that would work for us. You know, he wants to minimize our scan from our screens to our disposable, and hopefully move everything as close together to reduce our prime. One of my coworkers really likes to work on workflow, so she was going to focus on the software-based platform and the creation of profiles, whether we want to be surgeon-specific, case-specific, size-specific profiles. I had one of my teammates working on the different sensors that were available for the Essenz. How can we utilize all of those different modules, pressures, flows, levels to record different data during our cases? And lastly, for me, I was kind of focused on the overall goal. And my favorite thing is cable management. I don't know if I'll show you pictures of my pump if you ask, but everything is arranged in a certain way, and everything has just enough cable length to make it work. I guess I'm just a little bit OCD in that regards. Also, you know, another great way to reduce your stress and the daunting feeling of getting a new pump and launching a new project is the way that the LivaNova system worked with me. LivaNova people worked with me. So I had Ava Andrews email me shortly after we purchased pumps, and we got a really, really, really nice PowerPoint of how the installation guide was going to go, the steps we're going to take, the people that we work with. You can see I have Corey there and Eric. They're the 2 reps in my area, and they were super, super helpful in getting everything organized and getting the people in touch with that I needed to talk to. They have their face there if you haven't met them before, so you recognize them on a conference call or anything like that. And they have their cell phone there, so you can call them if you need them. You can see that they have a lovely kind of a guide there that shows you when your Essenz delivered, how long it's going to take it set up. You can see that it's color-coded essentially to tell you who you need to talk to in that situation. They tell you how long it's going to take your pump set up. So as soon as our pumps were shipped in, Lewis gave me a call and says, well, how do you want these set up? So you take them to your pump room or area where you have your cardboard cutout pumps idea set up, and then he essentially builds it for you the exact way you want it to. Then as you move on to getting the setup, you move in how to connect it to your system. So you can see there it's color-coded for you to talk to your software specialist. And then as you move on to on-site training and case observation, you get to work with your rep for that. So it was really easy to follow guide, and it really helped alleviate a lot of the stress that I had in trying to figure out who do I talk to, what's the timeline like. It really helped out a lot. So of course, when you get your pumps, one thing what I would recommend to do is you first, buy your mass system to kind of fit your existing tubing disposables. That way you don't have to worry about too many changes at one time. For us, it offered a lot of flexibility in this regards, that we had one design for our current setup, but then one tube or one mass design for how we want to be in the future. And that's one of the things I like about Essenz, is how flexible it is in the setup that you want to make. A couple of things to think about, is your OR orientation ever going to change? So we're actually getting new ORs here in the next year. And luckily enough, I think we're kind of in an ideal spot for us. We're across from the surgeon right next to the table. So keep our lines short. We can hear them without a problem. Trying to keep everything in one visual plane, and then again, minimize your change at one time. So here's your pre-installation phase. When you get your PowerPoint, they send you to some online learning. I'm pretty sure we're all familiar with that these days, but it's essentially an online course of 20 separate modules. And for a supervisor like me, I know it's really beneficial that you can kind of track your employees' progress and make sure that they're getting through the process before we actually receive any of our pumps. They actually give you a certificate when you're done that says, hey, I'm ready. I would recommend not sending this out to your crew too early, as they tend to forget a lot of what they go through. So maybe 1 to 2 weeks beforehand, you're able to receive your pumps, to get this learning out, have them go through it, and then have them get you your certificate so they're ready. And I know I felt ready afterwards, that I could essentially play and feel pretty confident that I knew how to do everything, just that it probably wouldn't be super fast. So the most difficult part of the implementation for me was probably some of the software stuff, and it's just mostly because I'm so unfamiliar with the technical language that they're using. However, we had a great team to work with, my Mayo IT team and also the LivaNova IT team, and we essentially sat down as we're setting up pumps and make sure that our pumps are talking to our capsule, which is then talking to our Epic charting system. So you can see, I don't know how well, but we actually track a lot of different variables during our cases every minute, and we were very excited with some of the new variables we could track. Me specifically, I was very excited to start tracking our venous flow. I know it's really nice to have an objective thing you can tell your surgeon that my venous return sucks. So, and this is why. So it's really nice to have that. We actually mapped out an additional cerebral flow, which is cool for us. So when we do our aortic cases, we can actually have our cerebral blood flow tracked into our patient's chart minute by minute. We also started looking at our venous occluder percentage, and I'm sure there's some other variables that we haven't mapped yet that we could probably learn and do. But a special shout out to all the IT teams involved, because I don't know enough about that. One of the things I wanted to make sure all you guys think about as you're implementing your Essenz is the scheduling. So we're very fortunate, we only run 2 ORs, but before we had any of our implementation, I got on the phone, talked to our scheduler. Please make sure none of our surgeons are off on these weeks, because we need everyone to be here so we actually have adequate cases to run. I wanted to make sure that all of our perfusionists had about 2 weeks worth of cases, or 2 to 3 cases per perfusionist. For us, it made sense to switch one pump at a time. We didn't want to buy all new equipment. We wanted to utilize some of the same equipment we had on the S5 and then switch it over. I know there's multiple theories you can do. I know Rochester, they like to switch as many as they can at one time and then say, this is when we're switching and this is when we're ready to go. But for us, it made sense. We actually, on Friday, moved one of our pumps over from the S5 to the Essenz. Then we had testing with IT to make sure all of our information was coming across appropriately. The person who was going to pump that case on Monday actually then did simulations with that pump. And then on Monday, they were ready to go. And then we did the same thing on Tuesday and Thursday. So we had cases Monday, Wednesday, Friday. Each of us got to do a case. on the new Essenz, and we made sure it worked appropriately before we used it. One of my favorite things is the profiles. I am not quite sure how we're going to utilize this as much in the future, but for right now, we have different sizes of patients that we utilize it for. We have 3 flow probes plugged into the back of our Essenz machine, and we have 2 3/8 probes and 1/2, and we basically, when you choose a profile, it turns on or turns off specific flow probes, so you can track your venous flow for each size patient. We're really excited in the future, whether we move to surgeon-specific profiles or case-specific profiles, where we really want to try one with our aortic flow probes that we have in aortic case, so we can get that number tracked into our Epic chart. I think the most important thing before you start with a new pump is practicing, right? So get in with your clinical specialist, run some simulated cases. We're very fortunate at our institution. We have like a online playground, so we have simulated patients, we do simulated cases, we can make mistakes, we can troubleshoot those mistakes. So we did a lot of that, and go through the motions, especially more than once. It takes a while to learn that muscle memory where everything is. So takeaways for me, I would say minimize, and for all of you, minimize the amount of changes at one time. For us, that means just focusing on the new bypass machine. I would say try not to focus on getting a new disposable pack right at the same time and changing a whole bunch of other ways that you manage. I would say focus on the bypass machine first, and then once you feel comfortable, move on to a different change. We're doing that same thing. We're actually going to change here soon to try to utilize the dual head cardioplegia system that we currently use MPS, but we're excited about the opportunity that provides. I would say get in touch with your case scheduler. Make sure that you have your plan in terms of how you want to change your pumps over, either all at once or one at a time. Empower your team with some responsibility. I know the best way to get buy-in from your team is to give them some responsibility. So, and of course, practice, plan, practice. And with all those thoughts there, it essentially made a seamless transition from the S5 to the Essenz. And it really did, feel like a pump that was built by perfusionists for perfusionists. One pump controls one knob controls one pump. It was a great experience for us. So, Essenz is so advanced you can essentially do it while sleeping, right? No, that's just a joke. My rep caught me in between my pumping my case. As I turned, I must have been blinking or something. So he thought it would really be funny if I included this on my presentation. So here it is. And that's all I have. Thanks to everyone involved. Thanks to Corey. Thanks to Kristen. And much appreciated. So I guess we'll open up for questions.
If you have a question, please step up to one of the microphones here so the live stream audience can also hear your question.
A bit fast. Yeah. Sure. So yes, his question was if we did any electronic charting prior to Essenz. And yeah, we've utilized, so when I first started on Perfusion, I was very fortunate. I started with the Connect system, and then we moved over to Epic once Mayo purchased that contract. I haven't used the Essenz patient monitor yet, but I'm quite excited to see what it can offer. I love charting with Connect. I found it very easy, and I do look forward to how that interacts with our Epic system. So right now, we actually, with Epic, we're able to query data. We actually get a report card after our case is done that shows us quality metrics that we've created with the Epic team. I know with the Essenz Patients Monitor, they do record quality metrics. I would, I guess, pass that off to the LivaNova team on whether you're able to query data. I'm sure.
Yeah, I can go ahead and answer that question. We do have a raw data export functionality, so you can query that data. And in the near-time future, we will have tools for the hospitals to use to do further analytics or partnerships in that area.
Does a hospital have to use Epic?
No.
No.
We use Cerner at our
No,
hospital.
absolutely.
No.
We can integrate with any hospital EMR system.
What about with other data management systems like Talus?
With Talus, we would use the Essenz patient monitor, so we wouldn't be using Talus.
Okay.
But if there's a hospital EMR system like Epic or Cerner, we can integrate the Essenz data into that EMR.
All right. Thank you.
Hi, Matt. Brittany, also from Wisconsin.
Yeah.
I was wondering, do you still have your wet lab set up? And would you be interested in having other local groups come through so we could check out how you have things set up?
We just took down our wet lab setup a little while ago. We wanted to keep our third or utilize our third pump. We've been doing Essenz now, I think, for about 2 months, and it's been really nice. And yeah, I would really advocate for keeping that set up and using it until you feel really comfortable.
Does the main campus at Mayo have the wet lab with Essenz?
I'm sure they do. They actually have a whole simulation, an official simulation lab. Ours was just back in our perfusion area. I'm not sure how many are fortunate enough to have a whole simulation lab, but yeah, they're telling me they do. I haven't been over there yet.
Can we sign up?
I know.
I'll jump in there as well. We do offer wet lab simulations. We also have an Essenz system at the Orem Sim Lab in Detroit where you can do advanced simulation. We also have Califia devices, so we can come to your hospital and do simulation as well. So full training before you decide to purchase the system.
Thank you.
Hi, I'm Luke from Iowa. Thank you for a nice presentation. I saw similar presentations where it was a bigger team, but they used 1 or 2 persons as some kind of a champion to learn the system really well and then teach it to the other perfusionists. Is that something you would advocate? And then, are there any things that you would have done differently while you were transitioning to Essenz?
So I would definitely advocate for your first question on having some champions, especially if you run into a bigger institution. I think we're fortunate as a small institution that all of us have to be champions because we're kind of on an island when we're on call. So I would definitely say in a large institution you should have some super users or champions, and then try to make sure that those specific users are on call during your initial launch. In terms of doing something differently, not that I can think of right now. It actually went really smooth and essentially seamless, so we were really happy with our rollout.
Thank you.
How did the ergonomics compare to your previous heart-lung machines? Are you noticing anything different on a long pump run?
The one thing ergonomically that I noticed is how much easier it is to push around than the 5 pump base S5, which felt huge, and it is compared to the Essenz right now. Again, it has like the wheels, they can lock in like a drive position essentially. I don't know how many of you have pushed patient beds around before, but they have that same kind of function where you go in drive so you can steer easily around the hallways, and it has that same kind of function. Makes it really nice. And then our pump is set up in like a nice cockpit position now, so it's really easy to kind of keep your scan short, and we're right there. So yeah, we like it.
Yeah, let me jump in. From an ergonomic standpoint too, LivaNova, I had the opportunity to evaluate this pump before it came to market, and that was one of their biggest concerns was ergonomics and eye movement indicators. They actually did big studies, so they were able to consolidate on the cockpit for everything that you want to see, make it very mobile to bring closer or further away to you. So it's really they've really kind of thought of everything in that aspect of making it more mobile, making it the signature space smaller, making it easy to move, and making it very user-friendly when you think about data and things of that you want. So, Luke, to your question, in that evaluation process, we were able to take 2 people out. Sorry about that. That better?
Yes.
No feedback, sorry. We were able to take 2 people out, and the nice thing about having that user knowledge before we bring it back to the system was we were able to fill out jot forms to have exactly everything. So when they brought the pumps into your hospital, it was already what you wanted that you could talk about as a team. So when you do that online training like Matt was talking about there, it makes it a lot more familiar. You know where the information is on the screen that you're looking at. So it's a lot easier transition for you to do those things. So it's definitely beneficial to do that.
More? Okay, thank you. Anything online?
Are there any online questions?
Check. Check 1, check 2, check 3, check 4, check 5, 5, check 6, check 7, check 8, check 9, check 10.
See if this one's, yeah.